or Philippine Representative Dr. Rabindra Abengasihe, Dr. Rabi. Presidential Communications Secretary Martin Andanar.
Salamat, Rocky. Magandang umaga po sa lahat ng mga nanonood sa atin ngayon at nakikinig ng live mula dito sa press briefing room. Good morning to our friends sa Malacanang Press Corps. Let me start with my opening statement. With the confirmation of 2 cases of the novel coronavirus in the Philippines, the administration assures everyone that the government is taking necessary actions to quell the spread of this contagion. President Rodrigo Roa Duterte has ordered temporarily banning the entry of any person, regardless of nationality, except Filipino citizens and holders of permanent resident visa issued by the Philippine government, directly coming from China and its special administrative regions, Hong Kong and Macau. The President will be presiding later today, the next meeting of the task force. That's going to be in the afternoon. And there will also be a press con after that. So it's open to the media. The Department of Health has released protocols in cooperation with other agencies of the government and has been providing up-to-date advisories to address the misconception and the virus and how to protect oneself from incurring such. Caution is vital, and we ask the public to consider only vetted reports and updates from the Department of Health and other lead government agencies. Meanwhile, the Department of Foreign Affairs, or DFA, has earlier said that it can repatriate Filipinos in Wuhan City back to the country for free, provided that existing rules and laws with regard to the virus are strictly observed. Mandatory quarantine, among others. In times like this, it is easy to mislead our fellow Filipinos, so we urge the public to stop spreading rumors and goading fears, as well as ending the stigma against specific nationality or race. There is no room for discrimination, and there should be none at all. Let us set aside our individual differences as we ask for a moratorium to people who want to hijack this situation and reduce it to mere politicking because lives are at stake. United in one common purpose, we will overcome this health scare. And now I turn over the microphone to Dr. Carlos of the RITM. Good morning, ma'am.
Good morning. Good morning, everybody. I would just like to give a few presentation slides on what is currently known about the virus and what our agency, the Research Institute for Tropical Medicine, has been doing to address this with the Department of Health. So we now are well aware that this is a coronavirus, and its name has been derived because of its appearance of spikes on the surface. Next, please. It causes about 10 to 30% of upper respiratory tract infections in adults, and we may have been infected unknowingly with this virus in the previous months of our lives. Next, please. The emergence of the virus actually is suspected to have arisen from some animal species, and currently being suspected are the bats population. Next, please. The spectrum of illness can be wide range from asymptomatic infection to simple cough and colds, fever and diarrhea, to pneumonias, to severe respiratory failure, and in fact to death. Next, please. There are currently 7 now known coronaviruses. 4 were previously known as human coronaviruses. Then came the SARS, MERS-CoV, and now the novel coronavirus. Next. We know that it originated from Hubei in China. Next. And just to emphasize, the age group mostly affected are on the average 55 years based on the latest publications, mostly males at 68%, and more than half have chronic diseases, notably cardiovascular and cerebrovascular diseases. Next, please. And main manifestations are fever in 83% and cough in 82%. Next. And infection is mainly acquired via respiratory droplets when an infected person coughs or sneezes. That's why it is advised that people with respiratory infections cover their mouth. Next. And the reproduction number, which basically defines the number of people that one sick person can infect, is about 2.24. So an infected person can infect around more than two other people in a non-immune population. Next. And no specific antiviral treatment is currently recommended, although there are many studies looking into this. Next. And treatment, therefore, is mainly supportive. If we compare the case fatality rates, these are the death rates of people who get infected in comparison with other infectious diseases, it's about 2% compared to 99% of cases of rabies, where we all know almost all people die of rabies once infected, compared to MERS of 34% and the Ebola of 39.8, or close to 40%. Next. And we have heard recently that WHO has declared a public health emergency of international concern for this infection, and Dr. Ravi can perhaps be the one to elaborate on that. Next, please. The more important steps to avoid getting sick are to prevent getting infected, and there are different ways of how to protect oneself. This has been emphasized many times by Secretary Duque: cleaning of hands, avoid touching our eyes, nose, or mouth with unclean hands or unwashed hands, avoid close contact with anyone with flu-like symptoms or colds, and avoid unprotected contact with live wild or farm animals. And of course, to protect others, we need to wear masks if we are infected. Next. There are ways of disinfecting objects and surfaces, and there have been proven agents, mainly hypochlorite solution, and there are already recommendations on how this can be prepared, which is projected in this slide. So diluted household bleach disinfects within 10 to 60 minutes from contact time. Next. And this is just a figure to illustrate how we prepare the solution from the original 5% bleach available in our department stores and groceries. And use of this may be therefore easy, since the chemical anyway is available in most groceries and supermarkets. Next. And the question of should we wear masks, this has been addressed in many occasions. And this is poster from the WHO. Yes, we wear masks if we have respiratory symptoms such as cough and difficulty of breathing, if you are providing care to individuals with respiratory symptoms, and if you are a health worker and attending to individuals with respiratory symptoms. Currently, since there is no community transmission of the novel coronavirus in the Philippines, we are not recommending its use for the general public who do not have respiratory symptoms. Next. So this is the usual surgical mask, and we have the colored portion outward and the white portion inward. And the proper way of using that is for the colored portion to be the exposed part and the white portion towards the person. The white portion is responsible for trapping the droplets from the individual wearing the mask, whereas the outer portion, which is colored, has some resistance to water, so it protects the wearer from droplets coming from the outside. Next, please. And if we plan to travel abroad, there are certain things that it may be best to observe. We need to get enough rest. We need to update our shots, especially the flu and other vaccinations. We need to observe good hand hygiene, and we need to eat and drink from safe, clean, and reliable sources. Next. And now there are already advisories on the need for persons under investigation to be admitted. And there are 4 criteria currently employed by the DOH in order to make an assessment of whether an individual is a PUI. And these considerations are the presence or absence of fever, presence or absence of respiratory infection, travel history for the past 14 days, this time already expanded from Hubei only initially to the whole of China and its administrative regions, and history of exposure to an infected person or working in a facility caring for infected people. Next. And we have this guide tool distributed in all of the DOH facilities to help health workers make an assessment. Next. And we have certain criteria to discharge, mainly 2 negative specific novel coronavirus test results done 48 hours apart, if the patient is asymptomatic, if the lab tests are improving, and including the X-ray findings. Next, please. And now I will show some of the interventions that the RITM has been doing to help address the problem. The RITM is the Infectious Disease Specialty Center of the Department of Health. It has a 2-pronged role in responding to this outbreak, both in the management of persons under investigation and suspected patients who are infected, and for laboratory testing. We are providing the novel coronavirus PCR test to identify whether the virus is present from an individual's secretions. Next, please. So we have participated in the drafting of the guidelines on preparedness in response to this organism. Next. And continues to contribute to that. We are a member of the DOH Task Force for Coronaviruses. Next. We participate in many conferences to share information to the public. Next. And in the hospital, we coordinate with referring hospitals and the Bureau of Quarantine for patients suspected to have novel coronavirus infection. We receive patients arriving from overseas who are suspected to be PUIs, and we manage them. We do post-discharge care. We ensure that infection prevention and control measures are in place, and of course, the lectures. Next. In the laboratory, we coordinate with all facilities with admitted PUIs and process and release results of tests that we do for novel coronavirus. We have coordinated with the WHO reference laboratory for confirmatory tests initially. Next. And in the long term, as part of efforts to implement universal health care, we are participating in the establishment of infectious disease specialty centers in other parts of the country, so that the skill and the laboratory facilities for infectious disease cases can be shared with other areas of the country. We are planning for surge capacity testing, and we have provided some guidance for upgrade of DOH hospitals. Next. So that there are plans also to use an electronic tool to link EPI and lab data for risk assessment and assist in the procurement of reagents for our regional laboratories. I think that's the last. Next. Yeah. And of course, to comply more closely with international health regulations. These are standards which countries must comply with in order to be able to address properly any events such as infectious disease outbreaks that we are facing nowadays. Thank you very much.
Thank you, Dr. Carlos. Salamat po. Our next speaker is the spokesperson of the immigration. Ma'am Dana.
Thank you, Sec. In behalf of the Bureau of Immigration, Commissioner Jaime Morente, good morning to our colleagues from the government and the WHO, as well as our friends from the media. This is to give you a rundown of the actions of the BI to help fight the 2019 novel coronavirus. As early as the fourth week of January, all BI frontliners were required to wear protective masks to prevent the spread of the 2019 nCoV at the airports and seaports. The Bureau of Quarantine has likewise conducted pocket trainings for frontline airport personnel on protecting themselves from the virus. Last January 23, we have assisted the Bureau of Quarantine by providing information on PUIs. The following day, January 24, the BI has started denying applications for visa upon arrival for Chinese nationals coming from Wuhan province following the temporary cancellation of the Civil Aeronautics Board of all direct flights from Wuhan City to the Philippines. On January 28, the issuance of the visa upon arrival for Chinese nationals was suspended in an effort to slow down the arrival of Chinese tour groups. By January 30, despite not receiving any directive regarding travel bans, all frontline personnel were instructed to conduct prudent assessment of passengers and refer passengers who came from Hubei province to the Bureau of Quarantine for checking or double checking. On January 31, talks about the possible repatriation of Filipinos in China started. Hence, the BI created a special team of inspectors to conduct immigration formalities for them. On February 1, the BI implemented a ban on foreigners from Hubei province, following an order from the President to stop the entry of all visitors from Hubei. Notices were likewise sent to airlines and shipping agents requiring them to screen passengers before boarding to restrict the arrival of passengers who have visited Hubei province in the last 14 days. Yesterday, February 2, the President ordered an expansion of the travel ban to include the entire People's Republic of China and its special administrative regions, which are Hong Kong and Macau. The BI immediately implemented this and, following the President's orders, advised all stakeholders that all foreign nationals, regardless of their nationality, who will be coming from China and its special administrative regions, shall be turned back and not allowed to enter the Philippines. However, Filipino nationals and Philippine permanent resident visa holders will be allowed to enter, subject to a 14-day quarantine to be implemented by the Bureau of Quarantine. Other visa holders and transiting passengers will also be denied entry. The ban includes passengers who have been to the areas of concern in the last 14 days. The BI has also sent a notice to airlines and shipping agents requiring them to screen passengers before boarding to restrict the arrival of aliens who have visited China, Hong Kong, and Macau in the last 14 days. Also part of the ban is the departure of Filipinos going to China and its special administrative regions. The ban does not specify exemptions. Hence, all Filipinos, regardless of visa type, will be barred from traveling to China and its special administrative regions temporarily. The BI urges everyone to temporarily refrain from unnecessary travel and bear with the government as this measure is implemented. Commissioner Morente is appealing to the public, asking everyone to work hand in hand to ensure that the country is protected from this virus. Moving forward, the BI is ready to implement further policy changes relating to foreign travel as deemed appropriate by the Department of Foreign Affairs or the Office of the President as recommended by the Department of Health. Thank you.
Thank you, Spokesperson Dana. Now to our DFA Undersecretary, Ernie Abella.
Morning. The Department of Foreign Affairs continues to monitor the coronavirus outbreak and ensures protection of overseas Filipinos and the well-being and protection of the local population. No Filipinos in China are confirmed to be infected with the 2019 nCoV acute respiratory disease. None. There are 295,047 Filipinos in mainland China. The Philippine Embassy and 6 Philippine consulates general in China continue to issue timely advisories through the official website and social media like WeChat. All FSPs or foreign service posts have dedicated 24/7 hotlines that Filipino nationals can call. Public advisory providing hotline numbers for Shanghai Consulate General in Hubei Province. Hotline numbers of Philippine Embassy in Beijing, Chongqing, Guangzhou, Hong Kong SAR, Macau SAR, and Xiamen. Contingency plans of all China Foreign Service posts are continually updated to reflect realities on the ground. Second, the DFA announced Friday, 31 January 2020, an advisory calling for the voluntary repatriation of Filipinos in Hubei in China. They are to contact the Consulate General in Shanghai by today, the 3rd of February. The aircraft may leave for China sometime this week. A rapid response team from DFA UMWA, along with 5 to 7 medical personnel from DOH, may be deployed to fetch the Filipino repatriates.